Welcome back. We're discussing a tough topic on Canadians who die while waiting for procedures each year. Again, Colin Craig from Second Street Research, you've done some excellent research on this matter. I kind of actually want to ask you, what spawned this study? Why did you do this?
Well, it was like we talked about, it was stories like Laura Hillier's, stories like Michel Houle from Quebec. He was a patient, 72 years old. The healthcare system told him he needed heart surgery within 2 to 3 months. He ended up waiting 5 months on a waiting list before, sadly, he passed away. And then a few months after that, the government phoned him to schedule his appointment. So it's cases like that where we just thought, you know what, let's try and get at this data, see what governments have in terms of their own numbers on how many patients are dying, and see what the data shows. And as we talked about, the data is really bad. Governments should ideally be tracking this information. It's important. We're talking about patients' lives, patients' well-being, and it really should be something that's not only tracked, but released to the public. And a public opinion poll that we did through Leger found that 81% of Canadians think that governments should be transparent in disclosing data on how many patients are dying each year.
You know, whenever I travel to America, and I know this is not obviously a comparable situation, but when I travel to America, sometimes, you know, in Florida, I notice they'll have these large billboards at the side of the highway that says so many minutes at this is your wait time at this local health care center for emergency services. And I thought, oh, that's interesting. I would never think of that in Canada, but you can kind of know where to game out, if you will, where to visit the emergency room. If this data were available widely, Colin, would then people perhaps decide where they should seek out their medical procedures, or perhaps where to live and where there's better delivery?
It might. I mean, who knows what type of changes we'd see in society, but I think it would do a couple things. One, it would really help researchers understand where the problems are in the healthcare system and understand what's going on, as well as obviously patients and the general public, but also would allow people in the system to learn more about where the problem areas are and address it. And I'll just say this, there's something really crazy that happens in this country. If you're a private business and you have a workplace accident, well, governments require all kinds of paperwork and disclosure of information as to what happened, even for minor incidents where workers have received so much as a bruise. And yet in government, we literally have people dying on waiting lists while they're waiting for the government to provide health care. And there's next to no disclosure. When that happens, we usually find out about it because the family members or the patient themselves go to the media. So if governments started to meet the same standard that they meet that they expect private businesses to meet, then I think we'd all learn a lot more about patient suffering in the healthcare system.
And Dr. Whatley, obviously, as you mentioned, this is a huge problem in Canada, or it's a pressing problem. You dedicated a whole book to this issue. What do you feel is the most pressing need or that we need to address as it comes to patient wait times? Yes, we need more data, but then what can be done after that?
So how long do we have? We have an hour for this program, right? So this is a gigantic issue. And just to start, I mean, you raised a fantastic point about wait time in minutes. Even just getting our system to reorient so that we're publishing wait time in minutes when you're talking about emergency care is a Herculean task. But people are now starting to do that over the last 5 to 10 years. We used to report wait time in hours, and you'd find out about it a few days later. So we need wait time in minutes, and it needs to be in real time, not so much for patients, but so that the system itself can adjust, so that we can say, hey, we're running out of resources, we're losing the resilience we need to provide good service. I do worry, though, about suggesting we should drive patients to a better place, or patients should be smart enough to go to the right spot. There's a real anti-patient sentiment within our system that somehow our system would function better if patients were just smarter and they would do what they're told. I actually strongly disagree with that. I think if we've promised to provide care, then we need to build a system that will deliver the care that we expect for our friends and family. People who work within the system get that kind of service when we show up, so we should be able to deliver that for everybody.
Right. And, you know, we're going to talk about solutions in the next segment, but, you know, one would think that coming out of COVID, we learned of, you know, we now know where the ICU hotspots are all across this province, that perhaps we would be better equipped now to be able to produce that kind of information to the public. In the 30 seconds we have left before commercial, Dr. Whatley, do you think we're better equipped now with COVID, with the COVID experience?
COVID taught us a ton. We already knew a lot coming into COVID that we hadn't implemented. I think there's a great opportunity to do even better. We've known about the problems for a couple decades, and now let's get going.
Right. Well, again, I find this a very interesting topic. I have 5 children. This is between managing parents and managing children. I think healthcare is very important, and where to drive whom to what for what procedure is a top of mind for many families. We're going to pick this up right when we return from this commercial break.